Welcome back to Let's Talk About It, a social work podcast. I'm your host, Edward Parati Sousis. This is the final episode of our first season, and I want to begin by recognizing that if you are still with us at episode 10, you have stayed with some heavy, complex, and deeply personal content. Across this season, we have asked what happens when Black veterans try to access care, benefits, and respect that they've earned within the VA system. We have walked through history, examined claims and numbers, sat with chronic pain and disability, and centered the experiences of Black women veterans, particularly those who have survived military sexual trauma. We have looked at intersectionality, organizational climate, DEI rollbacks, data gatekeeping, and co-design. At each step, the goal has been to make visible the patterns that are often felt, but not always named, by the people most affected. From the beginning, I did not want this season to be just another lecture on disparities. I wanted it to function as kind of a blueprint, something that providers, leaders, and veterans could carry with them into their everyday work. The aim was to offer concrete ideas and questions that might move the needle on equity, even in systems that feel slow or resistant to change. But it was equally important to recognize my own positionality. I am a veteran, but I am not a Black veteran. I am a white man. That shapes how I move through the VA and through the world. And it means I cannot speak for Black veterans or claim to fully know their experiences. Because of that, it was essential to design this project in a way that shared power and elevated Black veterans' voices rather than centering my own as the final authority. That is why this season was built with a Black veteran advisory panel at its core. Panel members were co-designers, not an audience watching from the side. They reviewed outlines and scripts, they offered affirmation when something resonated, and they did not hesitate to challenge language or framing when it missed the mark. Their fingerprints are on every episode of this season, even if you have not heard their individual voices on the microphone. Knowing that a panel of Black veterans would read and respond to each script shaped my writing in ways that were both grounding and humbling. It reminded me constantly that this work is not theoretical. It sits inside real lives, real histories, and real encounters with a system that has not always been worthy of their trust. In this final episode, we're going to turn our attention to the process and to the voices of the panel itself. This is a reflective episode. It is less about introducing new concepts and more about asking what we learned from the panel, what they affirmed, and where they asked us to go further. We will talk about what it meant for me personally to carry the responsibility of centering Black veterans' experiences as part of my doctoral social work capstone, while also honoring the limits of my own perspective and the ethical constraints of the project. We will also name some of the gaps, the interviews with Black veterans that could not be included within this time frame, the VA staff who were not able to participate on air, and the data questions that remain open for future work. In segment 1, we will focus directly on the panel's feedback, what they saw in these episodes, how the series reflected their lived experiences, and where they called for deeper nuance or additional voices. We will look at how their input influenced the solutions episode and the language choices throughout the season. Later, we will talk about the voices we still do not have, frontline VA workers, clinicians, and leaders whose perspectives are essential to understanding how change actually happens inside institutions. And we will close this season by zooming out beyond the VA to consider how the lessons from this project might be useful to people working in other systems, like healthcare, education, or social services, who are trying to practice equity, whether or not they hold formal power. For now, I want to invite you into a different kind of listening. This episode is about reflection, accountability, and unfinished work. It is about honoring the contributions of the Black Veteran Advisory Panel and being honest about where this season is starting to point, not a conclusion. With that in mind, let's begin by turning toward the people who helped build this season with me. When I first started designing this season, I knew I did not want to create another series that simply lectures about disparities or points to a broken system from a safe distance. I wanted to build something that did more than diagnose a problem. I wanted to build something that included the people most impacted by the problem, in both the discussion and in the solutions. That is what led me to recruit a panel of Black veterans who could guide me, check me, and help ensure that the content actually spoke to their community's realities. I came into this as a white male veteran. I am part of the veteran community, but I'm not a Black veteran, and I cannot speak on behalf of Black veterans. From the beginning, that mattered. It meant this project had to be built around sharing power and elevating Black veterans' voices rather than substituting my own voice for theirs. The Black Veteran Advisory Panel was my way of putting that commitment into practice. They were not an afterthought or a rubber stamp at the end. They were co-designers. They read outlines. They responded to drafts. They listened to episodes post-production. They pointed out when something landed wrong or when an important layer of experience was missing. They brought their lived experiences as Black veterans, as clinicians, as leaders, and as people who navigate the system every day. One of the panelists wrote, "Your podcast is amazing. I definitely believe you share and represent the voices of Black veterans well." That affirmation meant a lot to me, because this season asked them to trust that a white host could hold their stories with care. For them to say they felt represented was not just a compliment. It was a sign that the process of co-design was working in the way it was intended. At the same time, the panel did far more than affirm. They sharpened the analysis and pushed the series to be more precise. One example is the conversation about representation. Throughout the season, I talked about the lack of Black providers within the VA and how that lack of representation contributes to mistrust and poor outcomes for Black veterans. The panel agreed that this matters, but one panelist highlighted something crucial. There is research showing that even Black providers, like all providers, can hold harmful biases about Black patients, especially Black men. Their point was not that representation is unimportant. Their point was that representation alone is not enough. What we ultimately need are providers, of any race, who do not deny the reality of systemic and structural racism, who are willing to practice trauma-informed and inclusive care, and who are accountable for the ways bias show up in their everyday work. That feedback pushed me to revisit earlier episodes and make sure I did not accidentally send the message that more Black providers is a complete solution instead of one piece of a much larger structural change. The panel also responded to specific episodes with a mix of affirmation and critique that deepened the story we were telling. One panelist shared that episode 3, where we focused on chronic pain, felt spot on to her as a Black woman veteran living with daily pain. She described paying out of pocket for yoga, bodywork, massage, and therapy because of the delays and barriers in accessing care through the VA. Another panelist appreciated that episode 5 centered Black women veterans and military sexual trauma. They pointed to the aurora of disbelief they see when Black women try to seek trauma-related care. For them, this was not just theoretical. It echoed what they see and live every day as both veterans and providers. Their feedback told me that this season was naming something real. It also reminded me that naming it once is not enough. It has to translate into how providers, supervisors, and leaders show up in practice. They also named places where the series could have gone further. One panelist noted that in episode 6, when we talked about intersectionality, they would have liked to hear more specific statistics on rising suicide rates among women, including firearm ownership among women veterans, and clear comparisons between Black women veterans and Black women who are not veterans. In episode 7, on climate and DEI rollbacks, they wanted to see more emphasis on who actually benefits from DEI structures when they exist, often white women, and how Black women and Black veterans can still be left out even when organizations say they are doing DEI. In episode 8, on data and gatekeeping, they wondered whether explicitly referencing tools like FOIA could have strengthened the point about transparency and accountability. None of this feedback undercut the season. Instead, it mapped out where deeper data, sharper examples, or additional episodes could continue the work we started here. The panel also held the tension around something that changed in the design of this project: the absence of recorded interviews with Black veterans in this season. The original concept for this podcast included direct, on-air testimony from Black veterans and from members of the panel. As the project was developed, it became clear that working with a vulnerable population in this way would require human subject protections. It became clear that including interviews as data would require full internal review board approval to ensure the safety of participants. This would result in a longer process than I had within the capstone timeline. That meant making a difficult decision. Instead of recording interviews from Black veterans for the season, we pivoted to co-design and advisory work behind the scenes. This was a necessary ethical decision. Veterans on the panel guided and shaped the content, but their voices did not appear directly as audio clips. One panelist reflected that including live voices would have strengthened the podcast and made the experiences feel more immediate. I agree with them. Practically and emotionally, the loss was real. That tension between ethical protections and the power of hearing veterans in their own words is part of what I carry forward from this project. All of this made the writing process heavier in a way that felt appropriate. I felt the weight of this responsibility every day while constructing this season. I spent a lot of time scrutinizing my own language. I wanted to be sure that my bias did not quietly show up in a sentence structure or in a word that objectified or distanced Black veterans. One small example, during editing, I heard myself say "the Black veterans" in a draft. On the surface, that might sound like a harmless phrase. But when I listened closely, it felt wrong. It sounded like I was talking about an object or a category instead of human beings with agency, history, and dignity. It did not sound like I was speaking about people who are my colleagues, my peers, or my neighbors. So I changed it. That is the kind of micro-level work that trauma-informed and anti-racist practices actually requires. Paying attention to where language subtly reinforces distance and hierarchy, and choosing something different. The panel's presence made that level of vigilance non-optional. Knowing that every episode would be reviewed by Black veterans who could say, "This doesn't feel right," changed how I approached the script from the very beginning. It shaped what examples I chose, how I framed accountability, and when I named race explicitly instead of hiding behind vague terms like vulnerable populations or underserved groups. It also reminded me that accountability is relational. The panel was not just reviewing an assignment. They were trusting me with stories that overlapped their own lived experiences. That trust demanded more than academic rigor. It demanded humility, transparency, and a willingness to revise when something did not land the way I intended. The panel also reflected on the co-design model itself, especially as we laid it out in the solutions episode. One panelist stated that they appreciated the co-design approach and saw its potential in a system where evidence-based practices can fail to account for the experiences of Black veterans. Having Black veterans at the table changes what counts as evidence. It changes how success is measured and which outcome is prioritized. That feedback affirmed that co-design was not just a methodological choice for this project, it is a direction for ongoing practice within the VA and other systems. It reinforced the idea that Black veterans are not just recipients of care, but experts in what equitable care should look like. So, in this first segment, I want to be clear about what the panel taught me. They taught me that representation without structural change is not equity. They taught me that ethics and feasibility are not side notes. They shape which stories can be told and how. They taught me that language is never neutral, and that respect is communicated in the smallest edits as much as in the big themes. They also mapped out the unfinished work, topics we only touched briefly, data we did not yet have time to fully explore, and voices that have not yet been brought to the mic. Their feedback is not the end of the story. It's part of the blueprint for what comes next. In the next segment, we will turn to one of the clearest gaps in the season, the perspectives of VA staff, frontline workers, clinicians, and leaders, who were not able to join us on air. We will talk about why those voices matter, what it was like to try to bring them into this project, and how future work can bring Black veterans, VA employees, and community partners together in deeper, more sustained ways. In segment 1, we spent time with the Black Veteran Advisory Panel, the people who walked alongside this project from the very beginning. We talked about what they affirmed, what they challenged, and how their feedback sharpened the story we were telling. In this segment, I want to turn toward a different group of voices, ones that are just as important to the story, but are mostly absent from this season: the voices of people working inside the VA system. From the outset, I did not only want to hear from veterans who received care, but also from the people who are tasked with providing that care and implementing policy day after day. I wanted to learn from frontline staff who check veterans in, answer phones, and schedule appointments, from clinicians who navigate productivity demands, documentation requirements, and practice guidelines, and from leaders who are accountable for budgets, performance metrics, and compliance. My hope was that their perspectives would help us understand why some of the changes we discussed feel so hard to implement, even when they look straightforward on paper. So I reached out. I invited individuals who work at the VA at different levels and in different roles to participate in this project. The responses I received were clear and consistent. They declined. When I asked why, the answers clustered around two main themes. Some expressed a very real fear of job loss or professional consequence if they spoke candidly in a public project about their experiences and opinions. Others said they had been told directly that, as a VA employee, they are not allowed to participate in this kind of podcast or speak publicly about internal issues without prior authorization. On one level, this is about risk management. The VA, like many large federal agencies, has communication policies designed to prevent misinformation, protect confidential information, and ensure that public statements align with official positions. The intent, at least on paper, is not to silence people, but to avoid misleading the public or sharing incomplete or incorrect information that could have serious consequences for veterans' care or benefits. That is a legitimate concern. In complex systems with high stakes, misinformation can do real harm. But there's another side to this. When employees feel that speaking about their experiences could cost them their job, or when policies are interpreted in ways that effectively prevent staff from talking openly about what is and is not working, something else is happening too. Whether or not that is the intention, it means that institution retains tight control over the narrative. It can choose when and how problems are named and by whom. It can filter internal realities through an official lens before they ever reach the public. And when the institution in question has a long documented history of racial inequity and mistrust, that kind of narrative control is not neutral. It's part of the structure. This is a concrete example of how policy or practice can be inequitable and even racist in its impact, without anybody writing the word race into the policy. Rules that make it difficult or dangerous for VA staff to speak honestly in public about what they see, especially staff who are Black or otherwise marginalized, end up protecting the institution more than they protect the people it serves. They also silence some of the very people whose insights we need in order to understand how and why inequity persists, even when individuals inside the system are trying to do the right thing. The loss of those voices leaves a huge gap in this project. The suggestions we offered in episode 9 about co-design, accountability, data transparency, and structural change were shaped by research and the experiences of Black veterans on the panel. But we do not have the full range of perspectives from the people who would be asked to implement those suggestions under real-world constraints. We do not hear directly from the scheduler who wants to overbook a day to squeeze a veteran in, but can't because of a policy. We do not hear from the psychologist who believes a veteran, but is required to use a screening tool that has never been normed on Black veterans. We do not hear from the mid-level leader who wants to change a clinic's workflow to reduce racial disparities, but is constrained by performance metrics, staffing levels, and national directives. Without those voices, we are left to infer why some of our proposals might be difficult to put into practice. Maybe there are legal barriers. Maybe there are union rules, technology limitations, or competing priorities that we, from the outside, cannot fully see. Maybe there are unspoken fears among staff who want to advocate for change but worry about being labeled difficult or not a team player. Those are not excuses for inaction, but they are part of the reality of how large systems work. When those implementation realities stay hidden or unspoken, it makes it hard to design solutions that fit the conditions people actually work under. This is one of the central limitations of this series. Because VA employees either felt unable or unwilling to participate, we do not get a complete picture of the barriers to change. We hear clearly from Black veterans on the panel about what is not working and what needs to change. We can see from the data and from history that the outcomes are inequitable. but we do not have full understanding of all of the organizational constraints, fears, and pressures that shape how staff respond to those inequities on the ground. That missing layer matters. It affects how we think about responsibility and strategy. This is another limitation tied closely to this one. Due to time constraints within the capstone timeline, I was also unable to build formal partnerships with community-based organizations that serve Black veterans and regularly interact with the VA. These might include Black veteran service organizations, community mental health agencies that see veterans when they cannot get what they need from the VA, or advocacy groups that support veterans navigating claims and appeals. People in those organizations see another side of the story. What happens when Black veterans move between systems? What barriers they encounter when trying to coordinate care, and how they experience the VA from the outside. If there had been resources and time to do so, the season could have included structural conversations with those community partners about the barriers they encounter trying to help Black veterans from a provider or advocate perspective. They could have described what it feels like to call the VA on behalf of a veteran and hit a wall. They could have named where coordination breaks down and what they wish the VA understood about the veterans they serve. That perspective remains mostly offstage in the season, even though it is central to the ecosystem of care that Black veterans move through. So in this series, we are left with three primary vantage points. The first is the research, peer-reviewed articles, federal reports, and data that show patterns of disparity and inequity. The second is the Black Veteran Advisory Panel, whose members brought their lived experiences and professional expertise to shape and critique the content. The third is my own perspective, as a white veteran who has navigated the VA, as a patient, and as a person who interacted within the VA during my Master of Social Work program. What is largely missing are the voices of VA employees who cannot safely or formally participate, and the voices of community-based providers and organizations that stand alongside Black veterans as they interact with the VA. I want to be very clear about what my own vantage point allows me to see and what it does not. As a veteran, I know what it feels like to interact with the VA from the outside, to schedule appointments, to sit in waiting rooms, to navigate telephone trees, and to try to make sense of benefits and eligibility criteria. As a social work intern inside the VA, I also saw firsthand that many individuals within the system want nothing more than to do everything they can to help veterans, regardless of race, gender, or any other intersection. I met people who stayed late, who bent rules where they could, who advocated for their patients, and who were deeply frustrated by the limitations of the system they worked in. My experience of the VA is that it is highly bureaucratic, highly structured, and deeply committed, at least at the level of policy, to evidence-based practices. There are layers of oversight, performance metrics, staffing algorithms, and practice guidelines that shape what frontline staff and clinicians can and cannot do. There is a heavy emphasis on standardization and fidelity to evidence-based protocols, often for good reasons, to reduce unwarranted variations and to ensure that veterans get interventions that have been studied and shown to work. But as we have discussed in the series, there is a critical question that often goes unasked: evidence-based for whom? When the studies that build the evidence base underrepresent Black veterans, or when outcomes for Black veterans are not analyzed and reported separately, then the phrase evidence-based practice can hide inequity rather than resolve it. A treatment can be statistically effective in a large white non-representative sample and still fall short, or even cause harm when applied to Black veterans whose experiences of racism, trauma, and mistrust are different from the majority of the participants in those trials. From the perspective of a clinician inside the VA, however, deviating from evidence-based protocols can be risky. It can affect their performance evaluations, their sense of professional identity, and their standing in a system that prides itself on being data-driven. Without candid input from VA staff, we are left to imagine how this plays out in practice. How often do clinicians notice that an evidence-based intervention is not working as well for their Black patients, but feel they have no sanctioned alternative? How often do staff see disparities in who gets timely appointments or specialty referrals, but feel they lack the authority or data to challenge those patterns? How often do leaders worry about racial disparities in their service line, but fear that naming race explicitly will trigger defensiveness, political backlash, or accusations of being divisive? These are questions we can pose from the outside, but they are questions that could be answered more fully by VA staff if conditions were safer for them to speak. And that brings us back to the structural issue. Policies that discourage or constrain public participation by employees might protect the institution from some kind of risk, but they also protect the status quo. They make it harder to surface the internal friction that are often the key to understanding why change is so slow. They make it harder for Black staff who see inequity up close to share their insights in forums like this one. At the same time, my experiences inside the VA also remind me that it is crucial not to reduce the VA to a monolithic villain. There are people in that system who are trying to push, who are asking hard questions, who are advocating for equity in ways that are not always visible to the public. Some are doing that work from a position of power, others are doing it from positions where speaking up carries real risk. Without their voices, this series cannot fully capture either the constraints or the pockets of resistance and creativity that exist inside the institution. So where does that leave us? It leaves us with an honest acknowledgement. This series tells an important story about racial inequity in the VA, but it does not tell the whole story. We have centered Black veterans' experiences through co-design and through a race-conscious, trauma-informed lens. We have drawn on research and data. We have named patterns and made concrete suggestions through a critical race theory lens. But we do not yet know in detail how those suggestions collide with or are supported by the everyday realities of staff and leadership trying to implement them. We do not yet know how community-based organizations that serve Black veterans would describe their partnerships or lack of partnerships with the VA. That is unfinished work. Rather than framing the gap as a failure, I want to name it as a direction for future action. One of the lessons of this project is that any serious effort to move the needle of equity has to bring multiple groups into the conversation. People who are harmed by the system, people who work inside the system, and people who operate alongside it in community spaces. It also has to create conditions where all those groups can speak without fear of retaliation. That means rethinking not only what we ask, but how we protect people who answer honestly. As I close this segment, I want to hold two truths at the same time. First, that the absence of VA employees' voices and community partner perspectives is a significant limitation of the season. It leaves us with a partial picture and a huge hole in our understanding of how change might actually play out on the ground. Second, that this limitation does not erase the value of what we have learned from the panel, from the research, and from Black veterans' experiences. Instead, it points us toward the next layer of work, creating spaces where VA staff and community providers can join veterans in co-design change with protections that allow them to speak freely and honestly. In the final segment of this episode, we are going to zoom out from the VA and talk about what this season has to say to other systems, healthcare, education, social services, and to professionals and leaders who want to practice equity in their day-to-day work, regardless of how much formal power they hold. We will also return to a point that has guided this entire project. This series is not an attack on the VA or the people who work within it. It is an invitation to examine structures, confront inequity, and imagine what it would mean to build systems where Black veterans do not have to fight to receive what they have already earned. As we come into this final segment of the season, I want to return to a point that has been important to me from the very beginning. This series is not an attack on the VA as an institution, and it's not an attack on the people who go to work there every day trying to help veterans. It is a set of questions and critiques aimed at structures, policies, and patterns that produce inequitable outcomes for Black veterans, even when many individual people inside the system are doing the best they can with the tools that they have. That distinction matters. It is easy to slip into a narrative where the VA becomes a single faceless villain and providers become stand-ins for harm. That kind of framing can feel satisfying in the moment, but it does not match reality, and it does not help us move towards solutions. The reality is that institutions are made up of people, some with more power, some with less, and those people are operating inside rules, workflows, performance metrics, and cultures they did not choose. At the same time, it is also true that systems are not neutral. They are designed and maintained by human beings, often in ways that reflect and reinforce existing hierarchies of race, gender, class, and power. We cannot talk honestly about Black veterans' experiences without naming that. Throughout this season, we have heard from the panel and from the literature that Black veterans encounter barriers that are not just unfortunate glitches. They are predictable consequences of systems that were not fully designed with Black veterans at the center. We heard about referrals that get canceled with inaccurate notes about inability to schedule. We heard about Black women veterans who are disbelieved when they seek care after military sexual trauma. We heard about Black veterans who arrive already braced for discrimination and whose understandable defensiveness gets labeled as aggression or poor communication. We heard about Black employees inside the VA who see inequities and try to name them, only to be told that they are blaming providers or making people uncomfortable. Those examples are not unique to the VA. They are patterns that show up across many systems: hospitals, schools, social service agencies, court systems, and workplaces of all kinds. This is part of why this podcast exists. If we reduce the problem to the VA is bad, then we miss the bigger story about how racism, sexism, and other forms of oppressions are woven into the everyday functioning of institutions. We also miss the opportunity to carry lessons from the season into other settings where Black people are navigating the same kinds of dynamics under different names. So, as we close this season, I want to zoom out a bit and ask, what might this series offer to people working in other systems? Healthcare, education, social services, higher education, or the nonprofit sector, who are trying to practice equity in their day-to-day roles. And just as importantly, what might it offer to leaders who have formal power to change policies, budgets, and structures, but may not yet see how deeply those structures are shaped by inequity? Let's start with individual practitioners: social workers, nurses, doctors, peer specialists, case managers, therapists, schedulers, and anyone else who interacts directly with people seeking services. One of the clearest lessons from the season is that equity is not just a value on a poster. It has to show up in the small, everyday choices we make. It shows up in whether we name racism explicitly when it is relevant, or whether we hide behind vague phrases like complex social factors. It shows up in how we respond when a Black veteran walks into our office already guarded, whether we label them non-compliant and move on, or whether we ask, what have your experience with systems been like in the past, and what do you need from me today to feel safe enough to engage? For practitioners, practicing equity can mean slowing down enough to listen for the history behind the presentation. It means believing in people when they say they are in pain, rather than defaulting to suspicion of drug seeking. It means engaging families and support networks, especially for Black individuals, instead of assuming that care should be contained within the four walls of the exam room or office. It means learning enough about structural racism and trauma to recognize when what looks like resistance or anger is actually self-protection in a context where harm has been real and repeated. And it means being willing to say, I don't know, or I got that wrong, when Black individuals point out that something we said or did was harmful. And these skills are transferable to working with any intersecting identities that are marginalized. For supervisors and mid-level managers, the work looks different but just as critical. These are the people who shape schedules, assign caseloads, decide how metrics are interpreted, and set the tone for how equity is, or is not, discussed in teams. Practicing equity at this level might mean protecting staff who raise concerns about racial disparities instead of treating them as troublemakers. It might mean building racial equity and anti-oppressive practices into supervision, not as add-ons, but as a standing agenda item where patterns are named and addressed. It might mean disaggregating outcome data by race, gender, and other intersections, and asking hard questions when the numbers show that specific groups are waiting longer, receiving fewer follow-ups, or dropping out of services at higher rates. Supervisors can also play a key role in supporting co-design. They can create space for Black veterans and other marginalized service users to give feedback in ways that are taken seriously and actually lead to concrete changes. They can advocate up the chain when they see that evidence-based practices, as currently designed, are not serving everyone equally. They can push back when productivity standards or documentation requirements make it impossible to deliver trauma-informed, culturally responsive care. They may not control the entire system, but they can refuse to normalize inequity as just the way things are. For executives and senior leaders, practicing equity means taking responsibility for the design of the system itself. It means asking whose interests are being protected by current policies and whose voices are missing when decisions are made. Leaders have the power to set expectations that racial equity is not a side project, but a core dimension of quality. They can invest in infrastructure for co-design, compensating Black veterans and other marginalized communities for their expertise, building advisory structures with real authority, and ensuring that major changes are tested with those most affected before they are rolled out. They can require that data be reported in ways that make racial inequities visible, not buried in aggregate numbers. Leaders also have the power to shift what counts as evidence. They can support and fund research that includes Black veterans and other marginalized groups in meaningful ways, rather than relying on studies that treat white populations as a default. They can recognize that lived experiences, qualitative data, and community-defined outcomes are part of the evidence base, not separate from it. And when inequities are identified, they can move beyond statements of concern to concrete actions, changing policies, reallocating resources, revising metrics, and holding themselves accountable over time. But even if you are not in a formal leadership role, there are questions from this season that you can carry with you into your daily practice, whatever your context. You can ask, who is missing from this conversation? When a committee or work group is assembled, you can ask, who benefits from this policy as it's written? And who is harmed by it? When you notice patterns that fall along racial lines, you can ask, what would this look like if we started with the experiences of Black veterans or Black clients instead of retrofitting their needs onto a system built for someone else? You can also bring the idea of co-design into spaces it has not traditionally been used. That might look like inviting Black veterans or Black clients to help shape a new group, curriculum, or outreach strategy. It might look like building feedback loops that are more than satisfaction surveys. Conversations where community members can say, this doesn't work for us, and know that their input will be taken seriously. It might look like noticing when we are talking about people instead of with them, and making that an explicit problem we commit to fixing. For Black veterans and Black VA employees listening to this, I want to acknowledge that none of these tips are a substitute for the structural changes that are needed. It is not your job to carry the burden of fixing systems that have failed you. The responsibility for change lies with institutions and with people who hold power inside them. At the same time, I hope this season has provided language and frameworks that validate what you have already known and experienced, and that it has made visible some patterns that are often dismissed or explained away. For white practitioners and leaders, inside the VA or in any other system, I hope this season has been a prompt to reflect on your own positionality, to ask where your power comes from, who it serves, and how you can use it more deliberately to share space, shift resources, and amplify Black voices rather than speaking over them. I hope it has challenged the comfort of colorblind narratives and made it harder to pretend that race is just one factor among many, instead of a central organizing force in how institutions operate. As we close this season, I also want to return to the idea of this podcast as a blueprint. A blueprint is not a finished building. It is a plan, a sketch of what could be, with room for revision as conditions change and new information emerges. This series has offered one possible blueprint for thinking about Black veterans in the VA, rooted in history, grounded in research, shaped by a Black veteran advisory panel, and limited by the constraints of time, ethics, and access. It is incomplete by design. There are whole chapters that still need to be written by Black veterans themselves, by VA staff who feel safe enough to speak, and by community organizations that have been doing the work long before this podcast existed. So in the next segment, we will end with the discussion and reflection of this series. As we close out this episode and this season, I want to take a moment to step back and breathe with you. We have covered a lot of ground together. We have talked about history and policy, trauma and pain, data and distrust, representation and rollback, co-design and accountability. We have held Black veterans' experiences at the center, while also being honest about the gaps in what we were able to include. None of that is light. If you feel a little tired, or heavy, or energized, or unsure what comes next, that makes sense. This work is emotional. It is political. It is professional and personal at the same time. My hope is that this series has done at least 3 things for you. First, I hope it has validated what many Black veterans and Black VA employees already know in their bones. That the inequities you experience are not isolated incidents or miscommunications, but part of large patterns that can be named, studied, and changed. Second, I hope it has given practitioners and leaders language and frameworks to see those patterns more clearly, and to stop explaining them away as individual failures or one-off mistakes. And third, I hope it has offered some starting points, some questions, practices, and structural ideas that you can carry back into your own corner of the world. This podcast is not a solution by itself. It is one tool, one story, one attempt to pull together research, lived experience, and critical theory into something that feels usable. You may disagree with some of what you heard in this season. You may have noticed things that were missing or wished we had gone further in certain directions. That is okay. In fact, that is part of the point. The goal was never to create a neat, closed narrative where every question is answered. The goal was to open up space for deeper, more honest conversations, and to do that in a way that respects the people whose lives are on the line. I also want to acknowledge again the limitations of this project. This season did not include direct recorded testimony from Black veterans on the microphone because of human subject protections and time constraints. We did not hear from VA employees who feared professional consequences for speaking publicly, or from community organizations that stand between the veterans and the VA. Those absences are not footnotes. They are part of the story. They remind us that even well-intentioned, equity-focused projects are shaped by power, policy, and resources. They also point toward future work that needs to happen if we are serious about co-design and shared accountability. Looking ahead, I see this season less as a finished product and more as an invitation. An invitation for Black veterans and Black VA employees to continue defining what justice and equity looks like within and beyond the VA. An invitation for providers, supervisors, and leaders, both inside the VA and in other systems, to ask themselves hard questions about how their practices, policies, and data either reinforce or disrupt inequity. An invitation for all of us to get more comfortable with discomfort and more committed to action that goes beyond statements and training. If this season sparks something in you, curiosity, frustration, recognition, resolve, I want to encourage you not to just let that feeling fade when the music stops. Talk about what you heard with colleagues, with friends, and other veterans. Bring one of the questions or ideas from the series into your next team meeting, supervision session, or planning conversation. If you're in a position of power, ask yourself what you can change. Not someday, but this year, this quarter, this month, so that Black veterans do not have to keep carrying the burden of navigating systems that were not designed for them. To the Black Veteran Advisory Panel, thank you again for your trust, your guidance, and your willingness to hold me accountable throughout this process. To Black veterans listening, thank you for your service, and for your continued insistence on being seen and treated with dignity. To everyone working for equity inside large, imperfect systems, thank you for staying in the struggle, even when progress feels slow. I am Edward Parati-Sousas, and this has been Let's Talk About It, a social work podcast. Thank you for listening, for thinking critically, and for caring enough to imagine something better. The conversation does not end here. My hope is that all of you will carry it with you into your practices, your leadership, your advocacy, and your everyday interactions, and that together, in all of the small and large ways available to us, we will keep pushing the needle of equity forward. Until next season, talk to you then.